Welcome to W10 Video Tutorials. In this video, we would like to introduce 5D heart color features. 5D heart color allows the interrogation of a stick spatiotemporal image correlation volume dataset using intelligent navigation technology. From the stick acquisition, 5D heart color automatically generates 9 standard fetal echocardiography views and blood flow dynamics of a fetal heart. This complies with the 9 standard fetal cardiac views simultaneously recommended by the AIUM, American Institute of Ultrasound in Medicine guidelines. Additionally, it provides important information about the heart growth in an easy and accurate way. 5D heart color is an option feature. To use this function, select the 3D probe in the OB application. To acquire the 5D heart volume dataset, press the 5D button on the control panel. The 5D Ready menu will appear on the touchscreen. Select Heart and set a scan angle and a scan time. If you run color mode before you select heart, you can use 5D heart color to display blood flow in the fetal heart. Follow the guide displayed on the left side of the screen to select the position to acquire the volume dataset. Press the Freeze button or the Set button on the control panel to start the volume acquisition. When you select the static mode from the 5D Ready menu on the touchscreen, the acquisition time will be shortened to 1 second automatically instead of the standard 7 to 15 seconds used in the XI stick acquisitions. When you select Breech Sweep on the touch panel, the volume scan is automatically corrected to perform the sweep for a fetus in a breech position. Because of typical fetal movements, it is recommended to obtain the 5D heart volume whenever the fetus is in the ideal cardiac scanning position. Resume the routine scanning immediately after saving the 5D heart dataset. To save the data, press the Save button on the control panel. The system will return to the 5D Ready menu. Select Discard when the acquired data is poor due to fetal movement. If Discard is selected, the system will return to 5D Ready menu without saving the 5D heart data. After saving acquisition data by clicking the Process button, enter 5D heart color mode. Stick Loop displays a two-dimensional cine loop that aids the user in determining the appropriateness of stick volume datasets before implementing 5D heart color. 2D cine image will be automatically played after the stick data is acquired. To analyze the anatomical structure accurately, it is recommended to review the cardiac cycle at least 2 times. Follow the guide displayed on the right side of the screen to adjust the heart into the proper position for 5D heart. You can reduce rib or spine shadowing by imaging the fetus with the spine positioned between 5 to 7 o'clock. Make sure that no shadows appear or that the shadows are minimized, including in the 3 vessels and trachea view. The shadows may obscure the viewing of a fetal heart anatomic structures. Appropriate image quality is necessary for diagnostic purposes. The stick volume must include the upper mediastinum and the stomach of the fetus. The upper mediastinum is the imaging plane where the transverse aortic arch, superior vena cava, and trachea are seen. Make sure that there is minimal movement by the mother and fetus during the exam. Also, try to avoid speckle and artifacts in the images. Artifacts can be reduced by using a smooth, uninterrupted, and continuous scanning technique. The entire thoracic diameter of fetus must be captured inside of the ROI. Press the Freeze or Set key on the control panel when you have finished the review. Follow the guide displayed on the screen to specify the location of the aorta. The sagittal plane will be displayed on the screen. Anatomic box is a tool used to mark anatomical structures within the stick volume to allow the display of standard fetal echocardiographic views. Follow the guide to designate the 7 requested points: aorta at stomach, aorta at 4-chamber view, crux, right atrium wall, pulmonary valve, superior vena cava, and transverse aortic arch. The 9 standard fetal echocardiography views will be displayed only after marking the 7 anatomical structures requested by the anatomic box. Pulmonary valve, superior vena cava, and transverse aortic arch are automatically positioned depending on the function of the predictive cursor. There are intelligent alerts to notify the operator about potential issues with the stick volume dataset, for example, location of the fetal spine at 3 o'clock. Marking alerts notify the operator when fetal anatomical structures used for the marking may be in different locations from what is expected. From the diagnostic planes, the system displays the 9 standard fetal echocardiography views to make diagnosis easier. Select the Labels button on the touchscreen. The anatomy in these standard views will be labeled with accordingly. Select the Play/Pause button on the touchscreen to navigate the cursor to BPM or phase at the bottom of the monitor on the left-hand side. BMP adjusts the cine playback to change the speed of the heart rate during playback, whereas phase adjusts the cine playback according to its systolic or diastolic phase. Use phase when image is frozen to cycle to a different cardiac cycle or phase, diastolic versus systolic, to better demonstrate the anatomy to be marked. When you select protodiastole on the touch panel, the cine position moves to the diastolic stage. And when you select a protosystole, the cine position moves to the systolic stage. Use the zoom dial button on the control panel to adjust the image magnification. Use the up and down dial button on the control panel to move the image up or down. Use the angle or LR dial button on the control panel to move the image left or right. Use the dial button to rotate the displayed image around the X, Y, or Z axis. VIS Assistance displays a standard view selected in diagnostic planes, along with an extracted view that may supplement that view. You can also change the extracted view as desired by using VIS Assistance navigation bar manually. From the 9-view screen that is automatically acquired, select the one view that you want to change. Next, press the VIS Assistance on the left. The navigation bar will be activated on the bottom of the screen. If you move the bar, the 3D cine will be played on the right side image. Fix the bar where the optimal image appears and select the Update Diagnostic Plane using the trackball key. It'll automatically replace the view you want to change on the 9 fetal heart views. The 5D heart color image with the VIS Assistance uses a navigation technology to improve the echocardiography views of the fetus and reduces displaying false anatomy. Thank you for visiting our W10 video tutorials. Please visit again for more information on using your W10 ultrasound system.